Okay, so today we were discussing sacroiliac dysfunction, how to evaluate it, and how to correct it. We talked about the sacroiliac joint is important for gait. Your gait is how you walk. How you walk transmits stresses through your body if you have dysfunction. So with the sacroiliac joint, as far as performance level, if you want to perform at a higher level, high school athletes, high school football players, you know, if you have joint dysfunction at that level, that's something you're going to build into your body. If you're working out, you're doing squats, you're building the muscles around a dysfunctional joint, then everything tends to change with that. So you want to be assessed before you start building on that joint. So early in my career, I had a couple Olympic athletes come in and they wanted an assessment to see if there's any dysfunction. So they were used as kind of the standard. Probably the two people that came in, they were the only people that came in my office that I could not find any dysfunction. Everything worked in their body, and that's what it takes to perform at that level. The normal person that walks around with joint dysfunction is not going to perform at the level of an Olympic athlete when you don't have the proper flexibility or movement. So NFL football players, typically they will have their own chiropractor, they'll have their own physical therapist, they'll have their own soft tissue specialist, because to perform at the level that exceeds everyone else, you have to have that performance in your body. If your body doesn't have that performance, then you're not going to perform. So the sacroiliac joint is instrumental because the pelvis forms a lot of the attachments for the structure and the core muscles in our body. So if you have that dysfunction, it's going to transmit itself throughout. Your gait will change. You will not be as fast, okay? You will not have the same flexibility when you run. You will alter your pelvis when you do. So today we're working with Jay. He is going to be the patient that has a history of sacroiliac dysfunction on the right side. So we're going to, he presents with low back pain. So low back pain, typically for sacroiliac, you're going to feel it more like a triangular area, okay? You have the pelvis here, okay? So you're going to see that not only is the sacroiliac not moving properly on this side, but all the muscular attachments that go from the lumbar spine down are going to be affected, because now everything is moving as one. So instead of having the flexibility down here, the body tries to compensate by moving up here. So also what that causes, you're going to see that on the side of dysfunction, you're going to see that since you're not getting the proper movement of the anterior and posterior muscles, you're going to see that the pelvis has rotated anterior. So we notice that when we look at it, when we look at a pelvis, we look at a pelvis as either going anterior or posterior, okay? So when your pelvis changes its position, this is where we look at postural correction. So the movement of the pelvis, either anterior or posterior, will change the leg length. So if you look at my arm, if my hand is the pelvis and the pelvis rotates anterior, you will see it draws the leg up, okay? If it goes posterior, it's going to bring it down. So you'll see a change in the leg length itself. So when we look at patients and we put them down and look at their heel lengths to determine whether the pelvis is in the right position, we use their feet. So that's why chiropractors or people that assess the spine will do that. So for Jay, we're going to have Jay lay face down. Okay, so when we have him lay face down, so we look at one of the ways to assess originally is just kind of look to see, all right, do we have any dysfunction as far as leg lengths? So what I'm looking at is the heels. Typically when a balanced pelvis, heels are the same length. So when I look down, the heels are lined up. For Jay, they're not. So I noticed that his left side of his pelvis is got to be posterior, okay, because he has drawn up a little bit, okay? So he's shorter on this left side than the right. So it looks like anatomically his right leg is shorter than the left, or longer than the left, but he's not. It's because of his pelvis has changed. So what I look at is I can challenge that by doing, okay, I'm going to temporarily correct it. So Jay, go ahead and lift your left leg up off the table. Okay, lower. Go ahead and lower it all the way down. And then lift your right one up. Okay, all right, lower. So what I'm looking at is the actual function of the joint. So go ahead and lift it up again. Do the right, do the left, okay. Do the right. Okay, back to the left. So what I'm feeling for, all right, relax. I'm feeling that I'm not getting the movement in the sacroiliac joints, because if you look at the back, here's the discs, sacroiliac, left, sacroiliac right. So what I'm noticing is he's not getting the proper movement down here. When you look for movement or when you want to assess the pelvis, so a normal gait is when you lift the right leg, go ahead and lift the right leg, you fire off the muscles, okay, from the glutes. All right, you can lower. So for the right leg, it's glutes, hamstring, and lower lumbar paraspinal muscles. And then at the thoracolumbar junction, you cross over. So this is where you get the crossover with the upper part of the left side affects the right, okay? So right leg is lower right, crossover at thoracolumbar, and then it's upper left. So left shoulder works with right SI joint. That's a normal gait. That's a normal function. Properly, when you have a proper movement, that's how they move. The same is on the left side, same situation. So if Jay lifts his left leg, go ahead and lift it. Okay, he's firing the muscles on the left side, crossover is thoracolumbar junction, and then he affects the right shoulder. Okay, lower. So what I'm looking at is Jay has dysfunction on the right. His pelvis is anterior on the right. He's not getting the proper movement. So I'm going to temporarily correct that by using the blocks. So tip up on the right. All right, lower. Tip up on the left. Okay, good. So now I've taken his pelvis and now his feet are in line. So he is pelvically in alignment. So what I'm doing is I'm stretching the right side of the anterior musculature. So now he is in a neutral position. Lift your right leg up. Good. All right, lower. And then lift your left leg up. Good. Okay, so what you'll find is it took less to lift it up. Did that feel more comfortable in that position, Jay? Yes. All right, so it was a smoother motion. So I anatomically corrected it. This is one way to correct the pelvis. So this is called sacroiliac technique, SI joint pelvic blocking. So after I put him in, now his pelvis is in a neutral position. So if his pelvis is in a neutral position, that means his discs are not in a rotated position. So think of it like this. If he's laying there and he has a pelvis that is anterior on the right, his pelvis is rotated, okay? So he's in a rotated position. Now if I block him, I put him in a neutral position. Now his spine's in a neutral position, so when I distract his spine, when I do lumbar distraction or traction, he is now in a neutral position, so there's no torque on the discs. So that can determine how much pressure is on the lower back. That's one way to work with it. So what we're going to do here is I'm going to actually physically manipulate the right sacroiliac joint to give him function back. All right, we're going to pull it back in. Good. All right, so I'm going to take the blocks out. Good. So I use the blocks to kind of confirm my thinking, just to double check it. All right, and I'm going to check his spine to see if there's any dysfunction down in this area, just to see how the muscles are. So I notice there's more tightness on the muscle group that's going to affect the right side. So I want to adjust his pelvis. So I'm not looking to adjust his back, I'm looking to adjust his pelvis. I want to adjust these sacroiliac joints right here. So if his pelvis is posterior on the left, I'm going to adjust that differently than on the right. Okay, turn on your side facing me. Okay, good. So we do what's called a sideline position, and this is called diversified adjusting, okay? So there's different types of manipulation with thrust. So you have thrusting versus non-thrusting. Thrusting, this is diversified. People refer to it as popping and cracking. You have different variations of that. You have Gonstead diversified are the biggest ones used. You also have a technique where the table actually pops up and then drops. Okay, that is called Thompson technique. It's a Thompson drop table. A lot of times the female chiropractors will use it because they can't generate the force on the pelvis that some of the males, no offense, but all right. So we're going to bend the top leg. So to adjust the pelvis on this side, so what I want to do is I want to lock the sacroiliac. So when I put him in this position, I'm putting the sacrum in a position that I can actually put pressure, okay? I don't want to adjust this. I want to say for instance, they have a disc herniation. We want to do a pelvic adjustment. So to do that, I'm going to come up higher on his pelvis. Okay, so I'm actually on the ilium. I'm going to rotate his body towards me just a little bit and then give it a thrust, okay? Good. All right, we got a good little release there. That feel good? Okay, so that was a small release, but it released on the sacroiliac joint. So I worked with it because it was a posterior presentation. So it went posterior and inferior. Okay, turn on the other side. So now this is his problem side. So the right side, bend, straighten. It's kind of like the reverse Heisman Trophy, okay? So what I'm going to do here, I want this, because remember, this is going anterior. So I want it to come back. I'm going to take an ischial, which is basically the butt bone, right where the hamstrings attach. I'm going to take that and I want to rotate the pelvis back, okay? So for me to do that, I'm going to take his body, rotate him towards me. There we go. And I got it to move back. Good. All right. So what I felt was when I put the leverage lower, I forced his pelvis to move back. The other side was just the opposite. Okay, I'll go face down. So I adjusted his pelvis without it touching his lumbar spine. So that will not affect, say you have a herniation, L4-5, and most people come in and go, I got a bad herniation. I don't want an adjustment in that area. Okay, I'm going to adjust your pelvis. I'm not adjusting the disc, okay? You can adjust the disc, but we're going to concentrate on the pelvis. And if the pelvis clears that out, then it's more of a pelvic issue than a lumbar issue. Some of our patients, all we do is decompression on the lumbar spine and adjust the pelvis. That's enough to take them over that edge, So women that have, childbearing, you have weight for 9 months, additionally adding weights, your sacroiliac joint becomes dysfunctional, okay? Because your body has to adapt to the weight, so you develop calcium in the sacroiliac joints to handle that weight. So you build up weight for 9 months and then all of a sudden it's gone. So what happens is the joints have to change again. So your joints as a female age with childbearing because it has to increase the calcification in the joint to handle the weight, and then it's gone. So your body has to adapt again, okay? So we're going to recheck it. Lift the right leg up for me. Very good. Okay, lower and do the left leg. Good, nice. All right, relax. So function-wise, I'm getting the proper firing. So I want to check here at the thoracolumbar junction. Okay, lift the right leg up again. Good. So when he lifts it, okay, lower. We're firing here and then across. Now he's getting the crossing. When we first set him down, he was firing both sides up the right, okay? He was not engaging the left side because when he lifted his right leg, he was not getting proper crossover. Now he's getting proper crossover. So that means his cross crawls or the exchange at the thoracolumbar junction is now in sync with the SI joints. Think of it like a triangle. Thoracolumbar junction, right SI, left SI, forms a triangle. If that triangle is functional, then you have a proper gait and you have a higher level of activity as far as sports. All right, so now lift the left leg up. Good. Lower. So we see that he's firing on the left, crossover at thoracolumbar junction, and now on the right side. So we now have restored function to his back, and that's going to help with the actual pain, but his pattern. So how I can also check that? Check his heels, okay? Now he is in the same position as if I had the blocks. So he is in a neutral position. So now his spine is neutral. So when I look up, I'm not getting this anterior rotation and posterior rotation. Okay, so essentially what we've done is we've taken the pelvis out of the dysfunction. Now it's functional. So then you take it to that level and then, okay, how do you keep it unlocked? Okay, how do you strengthen it and keep it unlocked? So here's one exercise to help strengthen it. Jay, you're going to lift the right leg up, lift it up, take it up as high as you can go, then take it to the side. Great, bring it back, and then bring it down. So now do all three motions, just do them separately. Go ahead and lift up, take it out to the side, bring it back, and then bring it down, okay? That's one way you're going to fire off just this joint itself, okay, and help strengthen it. Another way, you can do it on the hands and knees. Lift your left leg, your left arm up and your right leg at the same time towards the ceiling. Okay, so now what I'm doing is we're refiring neurologically that mechanism. Okay, lower. Now do these are called cross crawls. Okay, lift the right arm, left leg, lift them up. Okay, and you'll see these done therapeutically. All right, lower. But if this is not functional down here, this does not work. So I already checked him at thoracolumbar junction. That's working. So his dysfunction was down here. Another way to check it, or another stretch to do, okay, go ahead and turn over on your back. So when you have a dysfunctional sacroiliac joint, you typically will have the hip flexors. Since we're in a seated position all day, our hip flexors shorten, and that affects the pelvis. So on the side that the pelvis is anterior, like Jay's right side, his hip flexors are going to be shorter, okay, because they're tight. So when he goes to stand up, the hip flexors it's not lengthening at the same time, so it's creating that obliquity in the pelvis. So you can also stretch it. So we'll do some hip flexor stretches. Okay, so you want to take the pelvis, take the knee down. Okay, so push your knee up against me. Now you can do the standing up. You can push your knee against the door, let it relax. Good. So you want to work on the hip flexors, all right? So it's a retraining process, okay? Postural correction involves not only the joints, but the muscles that attach. But if you don't start with the joints, you can work the muscles out all day and you're not going to get to the same level. Okay, relax. Push up against me. Good. That's why PT, all right, let it relax. PT by itself is not going to fix it. Chiropractic by itself won't fix it. But if you put the two together, then you will become a functional skeleton, a functional person. You know, you'll get joint function back. So it's a combination of, you know, if you think of the muscles attached to the joints, if the joint is not working, you can stretch it all day long. So your skeletal system and the joints that involve it, they have to be working to get this kind of function. So, all right, thank you, Jay. And that's it for today.